All right, Mr. Fang. So we finished your assessment, and your teeth are looking better than they were last time. Looks like you've been doing some good biofilm removal at home, although there are still some areas where I'm seeing some plaque buildup. So I would like you to show me your flossing routine at home, and I'm going to assess if there's any areas where we can make some improvements. I'll hold up this mirror for you here so that you can see what you're doing.
Just tilt it back a little bit.
Okay. So let me talk to you about what I've noticed here with your technique is that you are pulling off a great amount of floss. We always want to use about 15 to 18 inches. It is a little bit easier for you to get around your teeth if you leave your thumb and your index finger free. So what I like to do is wind up all of this extra floss here. And wind the other smaller end around that. Here, I'm going to show you on my Typodont. So what I notice is that when you are pushing your floss through your contact areas here between your teeth, is that it seems like you're having kind of a hard time getting it in there because you have really tight contacts. And what I would like to see you doing is leaving just a small amount of floss here and making it very tight and kind of going in at an angle here and just using a seesaw motion, and that will help you get the floss in there without having it snap down onto your gums, which can cause damage to your gingival tissue there, and also push bacteria down into your gingival tissue. So when we're flossing, we want to make sure that we're always just establishing a routine so that we're going in the same direction every time so we don't miss any, because that's often, when we're brushing our teeth, we're just kind of thinking about our day and we're just not really fully present with the process here. So we'd like to build up some muscle memory so that you can just make sure that you're getting all of those areas. So I like to start in the back here. You always want to make sure that you are creating this sort of C shape with your floss. Can you see how that's going around so that it gets into the sulcus there? It's hard to get into the back one, so if you need a little bit of extra room, you can do that. So you want to get sort of seesaw it down into that area and make a C shape so that it's hugging around your tooth there. And then you want to go just up and down that surface about 6 times. And when you move it to the next tooth, you want a nice clean piece of floss so that you're not bringing that biofilm from one area to another. So just seesaw it down there at an angle, do your C shape up and down, and then you want to move it up and over the little mountain of gingival tissue there is called the papilla. So you don't want to damage that. You want to move that up and around to do a C shape on the back side, and just agitate that area there. So since you do have some history with gingivitis, I know that some of your pocket areas are deeper. So the thing about flossing is that it's really only gets down about 3 millimeters into that area there. So the problem that we might be seeing around your back teeth here, where you have deeper pockets, is that the floss is just not reaching down into that area. So I would recommend a water pick for that area. And about how many times a week are you flossing?
I haven't been good about keeping that up. I've usually been just using a water pick and brushing, but haven't been flossing lately.
Okay. Well, I'm not gonna get on your case about flossing every day if that's not your routine right now, but I would like to see you try to make an effort to do it more often than you are. So maybe, what do you think is a good number of times per week that you feel like you could work into your routine and commit to?
If I could start just developing the habit and doing it like 2 or 3 times a week, then maybe I could work upward.
Okay. Are you feeling when you are flossing your teeth? Is there something that's happening that's making it frustrating to you to feel like it's not an easy thing to work into your routine?
Yeah, I mean, some of it is just that because my teeth, especially on the lower side, are really crowded. It's hard to get the floss in there, and it's frustrating when it's snapping. And then also some of the gum bleeding, like you noticed before, that makes me less inclined to do it because it's painful.
That makes sense. So the thing about the gum tissue being painful is that is a sign of inflammation in the area. And I know it's a deterrent from flossing because it hurts and then you don't want to do it. The thing is that if you are flossing more often, then it's going to become less painful over time. So if we can sort of get that biofilm under control in those areas, then I think that you will have a lot more comfort when you are flossing going forward. Do you have any questions today about flossing or about techniques?
No.
All right. Well, we will see you in 6 months and just assess how this is working and how we can make any further adjustments for you to improve your biofilm.
Okay, thank you.
All right. Thank you.